Hello, welcome to the Bader Hour, a citizen assembly meeting produced by Staci Gustafson of the Universal Community Project. Dan Bader connects the dots between corrupt state government, pharmaceuticals, elites, climate change, vaccinations, depopulation, and more. What you need to know to be mentally healthy in a challenging world. Hello and welcome. I'm Staci Gustafson of the Universal Community Project, a 360-degree platform for holistic community problem solving. I am happy to bring you the wisdom of Dan Bader, a licensed clinical professional counselor and licensed marriage and family therapist. He has been trained to independently diagnose and treat mental health and substance abuse problems and has 23 years of experience working in community settings. He retired from the Chicago Department of Public Health in 2016. All right, let's move into Dan's presentation. And if there's time at the end, we can open the floor for some questions. So Dan, what topic will you be presenting tonight?
Yeah, thank you very much, Staci. I'm going to talk about informed consent and the management of depression. And what I'm hoping, and I'll try to point it out at various junctures, is that you can see the kind of parallel between what I'm going to be talking about in terms of informed consent vis-a-vis mental health problems, in this case, depression, and what's going on today with COVID-19 and the vaccinations. And I'll try to, talk about it specifically at a certain point. So what I have up here that I'm screen sharing is a presentation that I put together on depression. And I'm going to go through the beginning portion of this. It's kind of lengthy. And my goal here is to convey a clear idea of what informed consent would be in terms of mental health problems, or in this case, depression. And so let's begin and kind of get into it. And people who have seen some of my other talks, some of this will be familiar, but I've discovered over time that repetition of some of this really doesn't hurt, because it's easy enough to understand, but sometimes actually getting it assimilated, it takes a little while. So this is just the beginning. And what I would do is, so the first one is here, depression diagnosis. And in this slide, you see the client over there, the young woman, saying, I feel depressed, no interest in activities, have weight loss, insomnia, am tired, and think about suicide. So, and then the psychiatrist says, I diagnose you with depression. Right? Based on the symptoms, the subjective reporting of this client or patient, that's how a diagnosis is done, essentially. So let's look at the next one. And then she says to the psychiatrist, I already know I feel depressed, it's no news to me. But now that I officially the psychiatrist says, but now that I officially diagnosed you, we can treat the chemical imbalance in your brain with drugs. And that's pretty much how it goes. So let's look at, again, the 5 axes of a diagnostic statistical manual mental health diagnosis that was in play from 1980 until 2013. This was actually kind of a helpful way of understanding these mental health disorders. Unfortunately, and I'm going to go into it quickly, they altered that in 2013 to make it more obscure as to what was actually going on. So this, and in 1980 was the turning point in psychiatry. Up to 1980, in the 50s, or certainly before the 50s, but in the 50s, 60s, and 70s, almost the vast majority of psychiatrists did talk therapy. After 1980, they stopped doing talk therapy. Obviously, you know, there was a little bit of a, you know, there was a period of transition, and they started to prescribe medications. By the time you got to the 1990s, the medication was, you know, all over the place, being finally at some point in the 1990s, they allowed it to be marketed on TV with all the other, you know, drugs, the medical drugs. It's very hard to find a psychiatrist today who just does talk therapy of any kind. There are some. So let's look at this diagnostic system, 5 axes, the multi-axial system. So on axis 1, we have signs and symptoms. What that young woman was reporting to the psychiatrist are called symptoms. That's subjectively what I feel. I'm depressed, I'm sad, I have an anger management problem, I'm hearing voices. These are all symptoms that somebody is reporting. Symptoms will get you a diagnosis. And by the way, when you get a diagnosis, it isn't going to go away. All right. You know, you're going to, that's part of who you are for quite a while. So signs are things that a person can see. So if somebody is talking about something and they start to cry, or they start to get angry and get up and start pacing around, those are signs we can see. And that's the difference. The symptoms you don't see, those are just reported. Signs are things that you actually see. And signs and symptoms are what is looked at. In reality, it's going to be, for most people, it'll just be symptoms that are reported. I could say I'm hearing voices. I hear voices talking to me. I could be lying about it, you know, but that's what I'm saying. That'll probably end up getting me a psychotic disorder diagnosis. Just that, you know, just that alone. Okay, so we look, and so for example, axis 1, we have anxiety disorders, mood disorders, psychotic disorders. We could also put mood instability disorders. That's the bipolar spectrum of stuff. So you get a diagnosis on axis 1. Axis 1 is what the doctor or the clinician needs in order to provide services that are paid for by insurance. That's key, because insurance will not pay for something unless it has an axis 1 disorder. Before they went to this system, they didn't do that. You know, a psychiatrist could just simply, you didn't even need to give a diagnosis, really. You could, but it wasn't necessary in this kind of a way. So axis 2 are really dysfunctional behavior patterns, long-standing and cross-situational maladaptive behaviors. These were mostly personality disorders, you know, paranoid personality disorder, narcissistic personality disorder, borderline personality disorder. Those are some of the really well-known ones. They also had depressive personality disorder. The difference between the signs and the symptoms on axis 2 are really no different than on axis 1. It's just that these are long-standing, usually years and years and years, if not a decade or two, and cross-situational, meaning if I have an anger management problem, but it's only manifests when I'm at home with the family, then it's not cross-situational. But if I have that anger management problem when I'm home, when I'm at work, when I'm anywhere, then it's cross-situational. And obviously, that's going to really mess my life up or anybody's life up. And the insurance did not pay for axis 2, because if you got a personality disorder diagnosis, the thought was, well, we're never going to really be able to do much for you except help control your symptoms in the usual way, medication. So now we come to axis 3, which medical diagnoses or conditions. This is a key axis, which covers nutritional deficiencies. Now, when it comes to nutrition, and I'm going to get to that, we have two different levels of nutrition in a way. We have the micronutrient deficiencies, which consist of vitamins and minerals, essentially. So if you're deficient in vitamins and minerals, that can definitely result in signs and symptoms that are going to be considered to be indicative of a mental health disorder. We also have it's not listed right here, but we also have macronutrient inflammation problems. Macronutrient inflammation problems. You are consuming a diet which is full of inflammatory foods. And this can also result in signs and symptoms. So it's very important. And then we also have blood sugar issues and hormonal imbalances. Then we come to axis 4, which is psychosocial / environmental stressors. Here we have things such as financial instability. Maybe you're trapped in near poverty or poverty. Poor emotional support. You're relatively isolated for one reason or another. Inadequate community involvement. You have no active participation in any kind of community activity. And a lack of individual development activities. You're not really doing anything to improve your skill sets that you already have, or you're trying to acquire new skills. And then finally, and sometimes that could be, you could put there on axis 4, that's what I like to use, but on axis 4, you could put down marital problems, legal problems, etc. Housing problems. Axis 5 was level of functioning. This was a number between 0 and 100, indicating how well the person can function despite their mental health issues. It reflects to some degree the knowledge and skills an individual possesses. So with depression, which is you could be given a major depression disorder diagnosis. One person, even though they've got that, they can still go to work and they can still manage to function, essentially. Another person who has exactly the same disorder may not be able to get out of bed in the morning and is completely dysfunctional. This number on axis 5 was meant to differentiate between those two people who had the same diagnosis. This was level of functioning. If you had, well, they don't do this anymore, but if you had usually 70 or above, you'd be considered to be pretty healthy, mental health wise. And nobody was going to get 90 or 100 probably. And if you got down into the 20s or 30s, you were pretty much dysfunctional, and you could be in a hospital, psychiatric hospital. Okay, so this is the system that was used from 1980 to 2013. It kind of evolved, back in the 1960s and 70s. There was a very robust community psychiatric community. These were people who were psychiatrists, but they very much understood that a person's mental health was rooted in many, many ways in the environment that they lived in. And they were really concerned about it being able to differentiate this kind of a thing. So what needs to be understood here is, let me see what I have there. Okay. So if you looked at this system, which I considered to be a useful system when I was working, you can see that if you have problems on axis 3, medical diagnoses, and by the way, if I didn't mention it before, you could also have, cancer, cardiovascular, what all the regular medical diseases would be on axis 3. But if you have an axis 3 problem, let's say with your macronutrient diet, you're eating a lot of inflammatory foods, or you had micronutrient deficiencies, that's going to give you symptoms and maybe even signs up on axis 1. That's an important thing to understand, that if you have these nutritional problems, you're going to have psychiatric symptoms. At least the average person is going to have something. And so what's going on axis 3 affects, the micronutrients and the macronutrients, what you put into your body is going to affect the behavior of the neurotransmitters in your brain. And I'll, again, kind of go into that a little bit. So again, this was a useful kind of a framework for understanding disorders, rather than just being told, well, you're depressed, we're giving you a major depressive disorder, and we'll prescribe medication and you can go talk to a therapist. And that would be very typical. So let's look at this next slide. Post 2013, this was DSM-5. The multi-axial system was eliminated in DSM-5. Diagnoses that were previously listed on axes 1 to 3, which I just went over, were listed without reference to an axial dimension. This change blurred the interaction between medical and emotional behavioral syndromes. That wasn't helpful, really. And a lot of people really complained. Axis 4, environmental psychosocial stressors that can precipitate and maintain disorders, were downgraded to a contextual status. Yeah, we need to know you're living in a slum, or you have this, you're in an abusive household, but it basically was kind of minimized from the way it was in between 1980 and 2013, which wasn't helpful. And then finally, I say here, the National Institute of Mental Health rejected DSM-5 disorder definitions as a guide to the setting of research priorities. Lack of diagnostic validity was cited as the reason. In other words, we got to have some validity, but the two kinds of validity, external validity and internal validity. But, it's basically, and the question, to me was, why did they even do this? Because what it did was it made it harder for people to really understand what was going on. That didn't mean that someone like myself or another clinician or a psychiatrist could go ahead and explain it all. I continued to do it because I thought it was a good way for somebody who was coming in for treatment to get an understanding of what we had to look at. So let's get here to the next slide, which is multi-causality of disorders. So now here I'm giving a little explanation of some of this. Axis 1 implies emotion management and boundary setting problems. Those of you who've heard me talk about the 3 building blocks know that those are 2 of them. Emotion management is the first building block. Boundary setting is the second building block. So if you have something going on in axis 1, then it means you're having some emotion management and or boundary setting problems. This is the axis, I state again here, that establishes medical necessity for purposes of insurance reimbursement and the prescription of medication. They didn't get rid of that axis, that one wasn't going anywhere. Axis 2, again, implies long-term emotion management and boundary setting problems. The inventory of symptoms on axis 2 are very similar to the symptoms used for axis 1 diagnosis. Axis 3 denotes medical problems, and axis 4 denotes environmental stressors, both of which can precipitate and or maintain mental health problems. Axis 5 recognizes individual differences in coping capacity that can affect vulnerability to and recovery from depression and other mental health problems. And then in this slide right here, it just shows this kind of feedback loop, that if you have problems on axis 3 and axis 4, that's going to give you stuff up on axis 1. And then if you have problems on axis 1, you have severe anxiety symptoms or different kinds of symptoms, that's going to make it more difficult for you to take care of your medical issues, including your nutritional issues. And it's also going to make it more difficult for you to solve your environmental problems. So it's definitely a positive feedback loop between the symptoms up on axis 1 and then what's going on with what's axis 3 and axis 4 designates. Just really important to understand that. And to understand that, there's a multiplicity of variables at play. It's not just one thing, like you have a chemical imbalance in your brain, and what we give you is medication, just like you have COVID-19, and what we give you is a vaccination, essentially. It's both COVID-19 and these mental health disorders, there are multiple causes, things that are impacting it. And that needs to be explained if you're doing any kind of real service to the people you're trying to assist, So let's see here. So treatment for axis 1 and 2 problems. The remediation of symptoms on axis 1 and 2 require the mastery of effective emotion management and boundary setting skills, which can be applied to the removal of medical and environmental stressors. Next, medication, if it works, doesn't always work, can only partially anesthetize the emotional pain that manifests as symptoms. Case management interventions, like we're going to help you with your legal problems, your housing problems, you name it. Case management interventions can improve or correct some environmental conditions that precipitate and or maintain symptoms on axis 1 and 2. Finally, here we come. Informed consent demands that the above be discussed with a prospective client during the initial assessment. That's, informed consent is about letting somebody know, first of all, what are the options for treatment based on what is causing the problems. What are the options that are available to you for treatment? And it also, each one of those options requires that you explain to the person the pros and the cons of each option so they can make a rational, informed decision about what they want to do with their treatment. In the mental health world, informed consent, unfortunately, even though everybody, of course, just like you go in the, you have to sign something, but it is not usually presented in a meaningful way. And this is really, it's just really unethical. So let me get to the next slide here. Okay. Now, treatment for axis 3 problems. And again, if you have micronutrient deficiencies, vitamin mineral deficiencies, you're going to have problems with your neurotransmitters and you're going to have symptoms. If you are consuming, like so many Americans do, and in other countries, a very inflammatory diet, again, you're going to have problems up on axis 1. Now, so treatment efficacy requires the factoring out of axis 3 problems as soon as possible. Yes, Stacy.
What are inflammatory foods?
Okay, so inflammatory foods are generally anything that's, like fried, that kind of thing. It's there are certain fats, oils that are, I forget the exact names. I think one is omega-6 that are, if you use that, it's going to be very, very inflammatory. And the idea is that you just, and to understand, not only do you have to prevent the intake of foods that are very inflammatory, but you also have to understand, even if you're eating a relatively healthy diet, I'm not eating fried chicken and junk food and et cetera. What you have to understand is, even if it's healthy, you're probably going to have trouble getting the necessary micronutrients because our soils have been depleted of it. And what they do with the kinds of crops that get grown today, the grains and all of that, we have a horrible diet. I saw a statistic the other day that said, if it's true, that 44% of millennials, who I guess it was saying are turning 40 this year, 44% of them have one chronic disease. I mean, it's just, it's amazing. So, and part of it is, it's because the diet has deteriorated. If you went back to the, 40s or 50s, you still had a relatively healthy food supply compared to, the nightmare it's become over decades. So prior to initiating biomedical treatment for depression, all precipitant is something which is causing the problem to occur, and maintenance factors. Maintenance factors are huge in mental health and in other health issues. Maintenance factors means that, something is maintaining the condition that you now have. Maybe you're having problems with your lungs, you a little problem there. You keep smoking cigarettes. Well, we'll say cigarette smoking is a maintenance factor for your lung problems, something you really ought to stop. So prior to initiating biomedical treatment, meaning drugs, for depression, all precipitants, maintenance factors that result from micronutrient deficiencies, macronutrient inflammation problems, gluten sensitivity, which is an issue now, / celiac disease. Now, most people don't have full-blown celiac, but they do have gluten sensitivity, which again can give you symptoms, hormonal imbalances, and blood sugar dysregulation should be attended to. So in other words, when you're starting out treatment, you should be tested for all these things, which you can actually test for. You can do blood work, et cetera, test for these things. That's something you can't do with almost all of the psychiatric disorders. There are no tests. And last week when I was talking about psychotic disorders, schizophrenia, there is a small group of disorders that you can, to some degree, kind of test, when I was talking about people who are hearing voices, et cetera. But for most, all of it, there really isn't any, there's no imaging, there's no blood work. It's just you tell the clinician or the psychiatrist what your symptoms are, and they'll give you a diagnosis. Common sense would be, if I'm feeling depressed, I'm going to go try to get some help for it. I might need some therapy because I'm very poor at managing my emotions. I don't know how to effectively set boundaries with people. And I'm living in, circumstances which are not very good. But before I start taking medication, psychiatric medication, I need to factor out of the equation any micronutrient problems, macronutrient problems, uh, gluten sensitivity problems, hormonal imbalances, blood sugar dysregulation problems. And that way, when I go into treatment, like say therapy, I'm not going to be constantly plagued with problems, even though I like the therapy and maybe it's good therapy. But I still, the complaint would be, but I'm still having problems, and of course, if you continue to have these dietary problems, you're going to continue, even though you're getting, let's say, good therapy, good psychoeducational input, both or one or the other. It's just a problem, but they don't do it. When I was working for public health, I was always arguing for this. Why don't we get people the blood work to at least check and see where they're at in terms of their diet, and to find out if they have hormonal problems, et cetera. That way, maybe they can avoid taking medications, which after a while, most of them, you're going to become dependent on it because it's a drug, and some of them can be very, very addictive. And and then of course you're going to get all the side effect problems from taking the medications. It's like those ads they run on TV for medications. Yeah, you'll be helped, but we got to tell you there's 15 things you might have to watch out for, because you're going to really be wrecked up perhaps by this medication. And so why would you want to subject yourself to that kind of risk if there are things you can do to take care of what's causing your symptoms? And so when I did this presentation, I would show this slide, which is, good cover of research on micronutrient deficiencies and depression at the MAD in America website. This is a webinar. It's really good, and it's free. You have to register on the MAD in America website, but you can view it. And these two women, I think one is, maybe they're both PhDs, but they go ahead and so there's two PhDs and this other doctor, and they go ahead and they explain to you how micronutrient deficiencies are going to mess up your neurotransmitters, and that you need to pay attention to this. And then there may be something better at this point in time because this is from some years ago. But I said this is a good cover of research on inflammation and depression. So this book, A Mind of Your Own. She also has a website, Kelly Brogan, and that's what she's a psychiatrist, and she specializes in the macronutrient diet stuff. Pretty good kind of presentation and explanation. So here are some hormonal, yes, Stacy.
So you said that you brought this to your employer and they would not implement it?
No, but I mean, in all fairness, so who do you go to when you're working for an organization like the Chicago Department of Public Health? And and we have different divisions. There'll be a mental health division, there'll be an epidemiology division, different. But the thing is, I would bring it to the highest level of the mental health division. I would also bring it when I would have the opportunity to people who were in the upper echelon of the administration of overall of public health. And here, the problem is nothing would be done. And here we're public health, which is supposed to be very concerned with primary prevention. Let's try to save you from getting really sick. But again, you're up against forces, which are it's the corporate interests. It's the corporations, whether you're looking at, obviously big pharma is the major corporate complex that affects mental health services. But you also have big food, big ag, there's all of these corporate interests which want to control the narrative. And if we got everybody tested and corrected their axis 3 deficiencies and problems, well, they wouldn't need, not that many people would need medication. So that's why it's not going to, it could never happen. Nothing could happen in an organization, in these public health organizations, because whoever's the head of public health, you know, the commissioner, as we in Chicago, that person is responsive to the mayor, whoever the mayor is. And the mayor is always responsive to the corporate interests, the money. And that's how it goes. And, you know, I related before, I won't do it right now, but, you know, when I tried to go up against a corporate interest, and I was, you know, in my hoarding presentation, and, you know, all that they were concerned with is what I said that might offend a corporation, you know, the Koch brothers and British Petroleum. That was it. You know, it's the only thing they were concerned about. And that was coming down again through the mayor's office to, you know, the upper echelon of public health. Yes, Staci.
I hear frustration in your voice, and I wonder, I think you probably didn't start in the state as a conspiracy theorist or thinking you're going to find this. I assume that it's something you learned over years and frustration.
Yeah, absolutely. You know, all of us who come out of, you know, these graduate clinical programs where you get trained to be a clinician, you're given, you know, they teach you ethics, they pound, you know, what's ethically appropriate, and that, you know, we're trying to do, you know, altruistic kind of work and so on, theoretically. But again, you learn the hard way. As you know, as I used to say, reality on the ground was that public health, which I was so, when I got hired by public health, I was really happy. I felt proud to be part of public health because I knew it was about primary prevention. But again, I had to get schooled, as everybody does. And after a while, if you want to keep the paycheck coming and, you know, build up your pension, if you're, you know, if you're working like in for a city like Chicago where you get a pension, you know, you eventually have to put up with a lot of things. And you have to start to rationalize big time what you know, I tell the story frequently of where, you know, the people who are the administrators, they're always very, very concerned about audits. You know, every year you get audited, you know, all health organizations get audited by somebody. So what they used to do before we went to a computerized chart system, you know, you just used to have files, big, large file room. And so when there would be an audit coming, you know, the director or the administrator or somebody would start to look into some of this. And then they would say, you know, maybe a week before the audit, they would say, well, you know, this clinician hasn't done their notes or they haven't got their treatment plans up. Just remove any files from this person and we're going to put them away in a closet somewhere. So when the auditors come and they just pull, you know, files out supposedly randomly, they won't catch these. Now that was completely not only unethical, it's really illegal. But, you know, when I always, and there's a lot of other things that you had to contend with. And one time I was talking to this administrator who I liked, and I said, you know, aren't you sickened by the fact that you have to try to push this kind of stuff every time there's an audit coming on? And his answer was, well, we live in a sociopathic country. And so we have to, you know, when you're in Rome, do as the Romans. And that is reality. And most people would be shocked at, you know, the corruption and the whole system. And but yeah. When I came out of graduate training, yeah, I was, let's do things ethically, the appropriate way, and theoretically, even if you as an individual were not doing something, you were expected, you should report, but you have, again, there's a certain kind of group pressure, let's not start pointing fingers at one another, and the system was so Machiavellian, So when you worked, in a lot of these organizations, organizations where you're not like somebody who has a private practice, you're just billing insurance and you can control your caseload. Maybe you don't have any more than 30 clients at a time. But when you're in these other kinds of situations, you can have 60, 70, 80, 90, 100 clients that you have some responsibility for. And what happens, in that kind of a situation is the administrators always know that nobody is not going to be having problems either with their record keeping or they're going to have some kind of clinical problems because it's way too much. And that's why you have such heavy turnover in most mental health organizations. A lot of times they hire young people, they don't pay them that well, and they find out, oh my God, this is brutal. I didn't sign up for this, and they move on. And of course, a lot of the administrators are people who oftentimes never really had the skill sets to be a clinician in the first place, and they just move on quickly to try to take the administrative path. But what it came down to is everybody knew there wasn't any of us who didn't have some deficiencies all the time. And we were always under the threat that if you start making trouble, we know how to take care of you. We'll get you on your paperwork or something with your clinical behavior. It's the way the world works, unfortunately. That's how it manifested there, but you can, and if I could just jump, for a quick parallel with what's going on right now, it's very clear that there are many, many doctors in Europe, in the United States, in Asia, all over the place, who understand the major league problems with this whole COVID-19 vaccination rollout project. And yet they're frightened because if they speak up, they see what happens. All they have to do is start making examples of a number of doctors, and they've done that. And then people start to say, well, I can't give up my career, to stand up and speak out. And that includes people who are working for universities, and it's a huge problem the way these systems are set up. And most human beings can easily become somewhat corrupt if you need to be to survive. And that's the way it is. So we look at these hormonal imbalance problems. So thyroid imbalance can precipitate and maintain psychiatric symptoms. Hyperthyroidism can produce emotional lability, low frustration tolerance, intermittent sadness, anxiety, panic attacks, insomnia, and even in a few people, psychosis. So why wouldn't you check for, the thyroid? Now that's something which a lot of times, if you're just going, to your PCP, that's something that might be checked periodically, but it's essential that somebody coming into mental health treatment doesn't have that kind of a problem, and are starting to now take medication they don't need. Hypothyroidism can produce loss of interest, sadness, fatigue, attention concentration problems, paranoid ideation, and in a few people, psychosis. Well, that's kind of similar to what you get when you're depressed. And of course, and again, it's kind of the thyroid issue is better known than some of the others. And then we have seasonal affective disorder is associated with an excessive release of the pineal hormone melatonin. Light and or vitamin D inhibits the release of melatonin. So, so if I'm giving you informed consent, you're trying to come into treatment. These are things I want you to know. I want you to understand this so you'll take responsibility for making sure that you do not have any kind of hormonal problems, and there's others, before you start taking medication and going down that road. Blood sugar dysregulation. High blood sugar can produce irritability, fatigue, and concentration problems. Low blood sugar can produce irritability and anger control difficulties, anxiety, fatigue, insomnia, and attention concentration problems. A lot of these are associated with depression. So you don't want to have blood sugar dysregulation problems. You want to have your blood sugar under control. And if you have a lot of people, of course, have insulin resistance problems or they get full-blown diabetes. So let's see. Okay. So treatment for axis 4 problems. Those are the environmental factors. Most axis 4 stressors involve problems associated with need deficiencies. That's the third building block of mental health, such as financial stability, emotional support, community involvement, and individual development. Okay, therapy and case management interventions can significantly aid in the amelioration or removal of these stressors. Medication can partially anesthetize emotional pain, but it cannot take care of our human needs. And it's just, nothing could be more basic and fundamental than that. You can take, whatever, you can use opioids, you can, use cocaine and opioids. You can take any combination of psychiatric medications that you want. But at the end of the day, none of that, even though it'll help you temporarily with the emotional energies that are giving you trouble, it's not going to take care of your human needs. That requires action in the real world. If the environmental stressors are not constantly attended to, a person remains vulnerable to a relapse. So maybe you have at one point in time a nice emotional support system, but things happen and now you're relatively isolated, or maybe you only have one person in your system. Well, now, that needs to be improved. You need to expand your emotional support system. And that's not necessarily just going to materialize out of thin air. You have to be able to say to yourself, I've got to do something to get more friends, or I need to strengthen my relationships with associates at work, et cetera, to expand my emotional support. So informed consent demands that the above be discussed with a prospective client during the initial assessment. They need to know this. They need to understand that medication isn't going to take care of your human needs. In the end, you're going to have to actually do something to alter problem. In most cases, you do have to, if say you're in an abusive relationship, you can't stay in that and take, and go in and get your antidepressant, medication. And then, I used to have situations where usually most of the time it would be a woman coming in for treatment, and she's living with a guy who's abusive. And, the guy's all supportive of her coming in for therapy and treatment, medication, because that takes it, it's not, as a matter of fact, he ends up, he can say, I mistreat you because you're depressed. You're, the way you act and everything, you need to get yourself fixed up, and then maybe I won't have to be so upset with you all the time. And it's the reality is you may be very attached to that abusive person. Maybe they weren't abusive in the beginning, but the problem is if you stay there if you stay in that environmental situation and you can't get the person to stop by you trying to set boundaries, we'll teach you how to set the boundaries. You see what you can do with this person. And if you're not able to succeed, because he's not going to be responsive to any boundaries, then you need to get away from him. And now you need to learn to cope with the emotions when that attachment starts to, fall apart. And you're going to have to manage those emotions. And it's kind of a maturation process in a way where the person has to understand that if they don't alter that, then nothing is really going to change. And so again, axis 4 those problems are very important, as are axis 3, and they need to be looked at now. And this is just, again, kind of talking about what I talked about earlier, the axis 5 level of functioning. And then let me see where we are in terms of the time. Okay, so again, when I did this particular presentation, I then went to depression and need deficiencies. And I won't go over this right now tonight, the conscious mind, unconscious mind, as I've done previously. But it's very important to understand that it's kind of critical. The conscious mind is the mind in the modern world. That's where I know if I'm sick or injured, I can call 911, ambulance comes and takes me to a hospital, doctors and nurses look after me. The way the unconscious mind, which is rooted in a hunting, gathering, much more, primitive kind of a environment where survival, it requires you to have people who can take care of you if you're sick or injured. Otherwise, you just die, and that kind of thing. So the unconscious mind is always assessing the need areas. In the 3 building blocks of mental health, the need areas represent the unconscious mind and what it is focused on. And so here I will go over this. Need deficiencies and chronic emotional pain. So there's, so I'll just go through the slide. Need deficiencies can include financial instability, poor emotional support, lack of community involvement, and neglected individual development. Need deficiencies generate chronic emotional pain, usually a mixture drawn from the negative emotions of anxiety, sadness, shame, and anger. Emotional pain is instinctive and very similar to physical pain. Some of you may know that, the anatomy of the brain, the area for physical pain and emotional pain, are right together. And it's important to think in this context of emotional pain as being similar to physical pain. You have physical pain if something is wrong, you have tissue damage or something of that nature. And I would just always use the example. I'd say, if I put my hand down on a hot skillet, I'm going to feel the most intense kind of pain. And if I don't remove my hand immediately, I'm going to get tissue damage that's starting to occur, and I may not have a functional hand at a certain point. And so the severe pain represents, get your hand out of that, take it away. And it's the same thing with emotional pain. The emotional pain represents something that needs to be taken care of. If you're, let's say you're having chronic sadness and shame, the 2 big emotions of a depression, sadness and shame, or shame/guilt. And you don't have an emotional support system and you have no community involvement. Well, that pain is telling you, here's what you need to do. Get emotional support and get community involvement, and then I'll let you alone. It's the same thing as taking your hand off the hot burner. And you have to know this, because if you don't know it, you may not do anything about it at all. You won't even understand what's happening. And you won't differentiate chronic emotional pain from everyday emotional pain. You know, every day we have to manage negative emotions. We get frustrated. We get treated unfairly. Things happen day to day to day. You know, we're sleep deprived. But the thing is, chronic emotional pain is our unconscious mind, as I'm telling us that there is really something problematic here, and you need to correct it. And the way you correct it is you make sure that your human needs are being attended to. Again, a really important point to understand. Now, whoops. Let's see. Okay. Chronic emotional pain is associated with our hardwired emotional adaptation to small group tribal living situations. And you know, if you're somebody who believes, you know, God created us and all of that, fine. But you know, that's where we were after God created us, right? In these kind of situations. And if you believe it just, you know, it's an evolutionary unfolding, all right, you know, that's where we were. You know, living before we, you know, agriculture was kind of utilized and we became, you know, organized differently. Okay, so here we have the three outcomes, and this is an important thing. And it's part of informed consent in a way to know this. Three outcomes that result from chronic emotional pain. Emotional breakdown. Full-blown breakdowns usually terminate with one or more of the following outcomes. In the modern way, a psychiatric hospitalization, an incarceration, injury to self or others, destruction of key relationships, or suicide. With a full-blown breakdown. Now you can't, I would argue, and each person has, some people are much more able to tolerate a lot more pain than others, both physical and emotional. The thing is, the average person at some point, if you have these serious need deficiencies, you're going to end up having a breakdown. There's also a problem if you don't manage anxiety in the right way, you're going to also have a breakdown. And a full-blown breakdown is a very costly thing to go through. Or evolution of a maladaptive lifestyle, frequently addictive, devoted to partially anesthetizing the chronic emotional pain and thereby preventing a breakdown process. That's a lot of what's going on. If you're caught in, let's say, a semi-poverty or you know, near poverty environment, you're going to have chronic emotional pain from the financial material instability. And you know, if you don't want to have a full-blown breakdown, you need to do something to anesthetize that pain. And if you're not getting psychiatric meds to do it, which most people aren't, you're going to use the recreational drugs, including alcohol. People use alcohol, they smoke cigarettes, eat comfort food. Macronutrients are, you know, no good that they take in. And there's all sorts of things people can do to anesthetize the pain. And if you want to understand addictive problems, that's something you really need to take into account. That you're talking about people who have serious need deficiencies, usually multiple, and they need to learn how to get those corrected. And if it doesn't happen, you know, then don't be surprised that people are, you know, using drugs, drinking alcohol, which is just another drug, you know, et cetera, because they don't want to fall apart, you know, and they kind of, they intuitively, instinctively know that's where it's going to. You know, I can't stand it anymore, you know, kind of a place. And then finally, the remediation of the need deficiencies that generate chronic emotional pain. That's the outcome you want to get if you're suffering chronic emotional pain. You don't want to break down. You don't want to become an addict or some other very maladaptive kind of a lifestyle. And then finally, the remediation, that's the way to go. Learn, if you need to learn motion management, boundary setting, you need to change your diet completely. Let's do that. And then you can get rid of the need deficiencies. And that's something that maybe won't happen overnight, but you can learn to manage your emotions as you get the chronic emotional pain in an adaptive way. And if you're actually going forward trying to correct these, you're going to start to be able to get a hold of that interest, excitement, energy, which is what you need to concentrate and to take care of goals in your life, which will, to some degree, suppress some of the negative emotions that you're feeling. Interest, excitement is capable of overriding sadness and anxiety and shame. And then I go into the needs. I won't do that because of time and now what I kind of like to do is, just before taking questions, is just draw the parallel between what's going on with COVID-19 and the vaccinations. And so we have COVID-19. It's starting to come out now more in the mainstream media, especially since Senator Rand Paul questioned Fauci the other day about whether he was funding the Wuhan lab in China. And that's, of course, where almost certainly this virus came from, this genetically engineered COVID-19 virus. So the thing is, so we have this virus. And what they did was, they first of all, and you could forgive a lot of people in the beginning because basically what it was being hidden. Like I mentioned, I worked in our bioterror team at Public Health, which was put together around 2008, 2009. So I always had an interest in, bioweapons and that kind of warfare. And it was pretty clear to me in the beginning, based on hearing what people I respected were saying, that this was a bioweapon, whether it was released accidentally or on purpose. But in any case, so now you've got this virus. And they basically said, just kind of the way it happens in the mental health world, they said, all we can do right now is to shut down our normal activities so we don't have too much contagion. And then we're going to wait until we get a vaccine. Let's pray that these wonderful scientists can develop this vaccine, and maybe within 12 months. That's how they set it up. And what they didn't do is, which informed consent would require, is first of all, you should let people know what this virus actually is. What's causing it? What's causing some people to get very, very sick from this? And then you should have told people that in addition to some potential vaccine, which we now, and it's not a normal vaccine, but, this messenger RNA jab, you should have told people that you had therapeutics that were very inexpensive and very effective antivirals available right from the get-go. And that's it's hydroxychloroquine, or the hydroxychloroquine cocktail with the antibiotic in some cases, and then the zinc. And then you had ivermectin, another very effective antiviral. Those were available. So if you were getting informed consent, you would have been told, well, even Anthony Fauci was touting it as an antiviral, like maybe back in 2005. You would have been told that, guess what? You have that as an option. And in the beginning, we didn't even have the Operation Warp Speed vaccines. All we had was lockdown, destruction of our economy. I mean, our economy has been just so wrecked on so many levels, all around the world, actually. or a lot of places. And so informed consent would have said, we've got therapeutics for it. And also you would have been told that here are some environmental factors that get you really sick with COVID-19. Maybe you're over age 70, which means your natural immune system is now not what it was when you were young. And you basically, if you have, they said the average person who got really sick or died from COVID-19 was over 70 or 75, and that they had on average, statistically, 2.5 chronic conditions. So you're talking about people who are already very messed up. And those were the people who were super vulnerable to damage by this COVID-19 virus. And again, in the beginning, people didn't know. I was very anxious about, because I was looking at what they were showing out of China, out of Wuhan, China, people keeling over on the streets. They're going into apartment complexes, dragging people out, throwing them in vans, taking them to these centers, where they were in custody to get treated. But after a while, certainly by March, into the end of March it was very clear who was really being affected by this and who wasn't. Gee, hardly any children got affected by it at all, because they actually have very strong immune systems because they're young. And they also didn't tell people about micronutrient deficiencies. So most of the people who were dying, the vast majority, or about half of them, I think, were nursing home patients. And if in nursing homes, the nutrition is rotten. And in a lot of cases, they won't even allow somebody to take micronutrient supplements. And so informed consent, you would have known about the therapeutics, ivermectin, hydroxychloroquine. You would have known that you ought to be taking vitamin D3, vitamin C, zinc, quercetin, et cetera. A bunch of supplements. That's what you should have been told. And then you could have made a rational decision. Here's the thing, and I'm personally, of course, I live in Chicago. Many, many people in Chicago, especially in certain areas, they've been fully vaccinated. And so, I'm of course having to feel the pressure because I can see where they're kind of going. They want to try to force everybody to take this messenger RNA vaccination. And, to me, and it was always the case, it was like, and I did go to my PCP and I talked with her, and she has antivirals, and we made, I said, if I do get sick with it, if I come down with, a problem, that's what I want you to give me. And so that was fine. I had no intention of why, because if you think about what the messenger RNA is doing, it's taking, as they say, the recipe or the instructions to your ribosomes in your cells, and then they're constructing the spike protein, which is then going to, help you get antibodies. But what is the spike protein that's being created with the messenger RNA in your cells? If it's really represents the bioweapon virus, that's what you're getting. And why would anybody want that? Why would you even want it if you knew you could take supplements, utilize medications, and you wouldn't even, why would I want that? It's not a flu shot. It's not a polio shot. It's not a smallpox vaccination. It's not an ordinary vaccination. And of course, the fact that they hid the fact that, and it does appear like it's coming out. I'm not sure why now exactly it's coming out, but it is, because it was very significant that Rand Paul addressed it directly with Fauci, and Fauci is somebody who's, he's a public health psychopath. He's been that for all the way back to the days of AIDS and treatment for AIDS. And of course, he was made into, partly for political reasons, into, a saint almost. Whatever came out of his mouth was, good for you. And of course, Donald Trump, he got up there a couple of times in maybe March or April, wherever it was, and said, hydroxychloroquine and zinc is available. And then, of course, that was destroyed because of the corrupt medical journals and so on, which I've talked about before. And I know there's no time right now. But if you had informed consent, most people would not even think about getting a vaccination, but they did the same thing they do in the mental health world. Oh, you've got a mental health problem, get the medication. You can have some therapy too, but get the medication. And there's nothing else to be done. Yes, Stacy.
I was wondering if Ilya had one question before we wrap up here. Ilya,
Okay.
are you there? And do you have a question for Dan? We'll give Ilya 1 second to unmute here, see if he has anything. He is drawing on a tablet. He may not be able to ask a question. Okay. So, all right. Did you have anything else you'd like to add?
No. I think, again, informed consent is something which is not given in an appropriate way when you're trying to get treated for a mental health problem, because psychiatrists, they don't make their money in any other form really than prescribing medication. And of course, the pharmaceutical corporations who are responsible for the curricula that these doctors are exposed to in medical school and after have no interest in people taking supplements, eating a healthy macronutrient diet, et cetera. They have no interest in it. And, and again, I know people, it's hard to believe, but most of the people who are in public health are well motivated, the people in the trenches on all levels. But the upper echelon of public health is totally subservient to corporate interests, and many of them are very, very corrupt, and in a way, you're not going to get one of those top positions unless you know how to play the game with the corporate interests. You just won't be there. And it's very analogous to what I see has gone on with COVID-19. Obviously, this COVID-19 situation it's just such a unnecessary kind of a tragedy that is still unfolding. And last thing I would say, in terms of these economies, if you read Klaus Schwab's book published in June 2020, COVID-19 and the Great Reset, which all these elites are about, he just basically says, on top of everything else, he says, well, there's certainly going to be a number of financial black swans occurring. And it does look like those are probably on the horizon. Black swan, meaning it's going to be a serious financial thing, like what happened in 2008 in the real estate market. You're going to get some of these black swans, and then, people will be destroyed financially in terms of, making a living. And you can already see it's starting to come together. And I know at this point, everybody thinks or hopes that, again, there's light at the end of the tunnel. We're gonna come out of it. But again, they have no intention of going back to normalcy, for better or worse, because the whole economy is going to be changed regardless of COVID. They're going to, remember, we got to get 50% reduction in greenhouse gas emissions by 2030, and then zero net by 2050. How do you ever imagine in 10 years, you're going to get 50% cut in greenhouse gas emissions? It's going to raise if you're a truck driver or anybody who depends on, driving or fuel, the cost of going to take a international flight. My God, what do you think that's going to cost if they even allow it after, up to a certain point? So we might get a little bit of so-called normalcy in the very, very near future, perhaps, but it isn't going to last long. And people need to get themselves aware of what's happening. And okay, I've said enough. Thank you very much, Staci, and for allowing me to present this kind of material.
Thank you so much, Dan. It truly is, like you said at the beginning, something that needs to be heard regularly. You can understand it, but it's the fine details that keep coming through that make a real difference in my life. And I use what you have taught me every day for really, really important, good changes in my life. So thank you very much, Dan.
Okay.
And to our audience, please come back every week to learn how to connect more of the dots in this vicious cycle of corruption and how it relates to your mental health and quality of life. Thank you.